we're going to be showing you the positioning of the hand, the PA, the oblique, and the lateral positions, okay? And one quick note that I want to reiterate on any x-ray. If you can look at your cassettes here, there's an arrow here, and there's an arrow here. That indicates the head of the cassette, and that's going to affect the orientation of the images on our PAC system. So be mindful on any x-ray that if you're taking it in the lengthwise orientation, that this should be at the top of what your body part you want to hang it correctly as, okay? And then again, on the crosswise sort of orientation, is that this is going to be your top. So when you take your x-ray and all of a sudden, whenever it comes up on your screen and it's flipped around, this is why. So be mindful in your orientation of the image on your cassette, because it's going to affect what you see and ultimately affect our radiologists as well. We can't incrementally manipulate or rotate our images. It's only a 90-degree rotation. So it makes it very cumbersome sometimes when the radiologists have to turn their heads different ways, and just try and be more mindful of how you're taking your x-rays on your plates, okay? So again, we have our patient over here. Hello. Miss Annie. So this is a great example of older teens or children with bracelets and things. Lots of people come in with jewelry, which is beautiful, it's great, but we don't want it on our image. So always make sure and be mindful of taking off watches, bracelets, rings, that sort of thing. So if I have you take off your jewelry for me, please. All right, so for this x-ray, of course, as prior videos I've reiterated, putting the part of interest in the middle of the cassette, and again, being mindful of the head of the cassette so that it's oriented properly. So we're gonna take an x-ray of her hand, and I'm gonna put her third PIP, because that's my center, in the middle of the image here. So this is actually gonna be my central ray, my positioning here. If you see my light, I'm gonna put it right here. So the important thing again is to remember not to collimate too much. We don't want to be too close in getting clipping out the thumb. That happens quite a bit. So we want to open up your collimator here, and then we're going a little close here, and then we don't have enough wrist either. You want about third distal of the wrist itself. Okay, that would be how I would position our patient, and this is where I'm going to put my marker. Right up there. Oh, it is left. See? Even x-ray techs marking correctly. There you go. So left x-ray, make sure it's not too close into your patient's anatomy. Put it here, you can put it here. It doesn't matter as long as it's not tucked up under the patient's anatomy, okay? So another caveat to this is a lot of patients have like rhinestones and decorations on their nails. Please make note of that in the notes and understanding so we can be aware that they were unable to take them off as they're adhered to the nail or unwilling, okay? So very important. So that's your PA hand. Okay, so now, very simple, we're gonna do the oblique hand. And a lot of times what I'll do is I'll go ahead and take their hand and I'll just kind of turn it at about a 45. Central ray is gonna remain the same. So I adjust it just a little bit, and there's your oblique. Another way you can do that, if you have positioning sponges, you have a patient that's unsteady, and I apologize, this is such a big sponge, but you can go ahead and place their hand on a positioning sponge to keep it nice and stable for you, making sure that you have a nice still x-ray. Of course, motion is the worst enemy of radiology. All right, so once you've taken this x-ray, now you're gonna go to an lateral view, and you do have hand sponges out there which you can absolutely use, but I'm gonna show you the free form way of how to do a hand x-ray for lateral position. And so I always tell my patients, give me an okay sign, start with that. As you notice, the fingers are sort of splayed apart. Sometimes people will go ahead and line them up a little bit, and that's okay, you can address that in a minute. So we're gonna reorient this a little bit. Keeping the PIP joints in the center of the image, I'm gonna go ahead and orient my machine just like this, my light, everything. Turn my marker to the inside. And we can actually straighten your hand just a little bit. Is that okay? Mm-hmm. All right. All right, so now what I tell them is just relax here a little bit. And then what's important is to make sure that you splay these fingers out, but you have to keep these joints itself nice and straight. You don't want them pinching their fingers together so tight here. You'll have overlapping of the bones here, so you want them nice and relaxed here. So it's going to open up all these little joints, and again kind of splay these fingers out just like so. And that would be your lateral hand x-ray. Easy peasy. And that's how you x-ray a hand.